Hi, this is Dorothy Preston, and I'm here with Rodeo, or not, to talk to you today about feline leukemia virus. It's a virus I see mainly in cats 2 years of age and younger when it first is diagnosed. The disease itself can look like anything. Even a perfectly healthy cat can have leukemia virus, and frequently that's how I see them if I'm just routinely testing. Leukemia virus, what it does is it destroys their immune system. It gets in the bone marrow and it makes them die with diseases that they could normally fight off. It seems to be in cats, they get infected with it when they're younger than 2 years of age. So if you have a cat that's 5 years of age and it is around a cat with leukemia virus, it has pretty much a normal exposure and then it fights it off. Whereas a cat that may be 5 months of age that's exposed to a leukemia positive cat, they're much more likely to develop the active virus. So what happens is the virus gets in the saliva and the lymph nodes in the throat, and then they either fight it off or they don't. If they don't, it goes into the blood system and into the bone marrow, which then they have it for life. There's a small percent of population of cats that have a latent infection where they actually have it in the bone marrow, but they aren't actively producing the virus and they won't test positive for it. It only will come out if they're immune compromised. So that's a small percent. Most cats, if they test positive for it, they have it. If they test negative for it, they don't. It's important to know because this disease is deadly. It may not be deadly today, but it is deadly. The average lifespan of a cat with leukemia virus is 2.4 years after they get diagnosed, after they start showing symptoms. They can live longer with proper care, being kept indoors, being kept away from diseases, but their lifespan is shortened. It's highly contagious, and about 2% of the cat population on healthy cats have and carry this virus. It shows things anywhere from gum disease to chronic bladder infections to definitely cancers, lymphomas, heart disease, pneumonias, skin cancers. It looks like everything. So when I come to you, you bring me your sick cat and I say, look, this is the second cold your cat's had this winter. Let's test. It's because there is a chance, even if they're indoors. This is a disease that they might have contracted when they were 6 weeks of age, and they're now 18 months. So it can affect all cats in any walk of life if they've been exposed to another cat in their lifetime. There is a pretty good vaccine against it, and it's not considered a core vaccine, meaning that there is some risk involved in giving the vaccine. There is a small percent, 1 in 10,000 cats can develop a sarcoma from the vaccine. So I don't vaccinate those indoor cats that have no exposure to another cat. But I will vaccinate a cat that goes outdoors or a cat that is associated with a cat that goes outdoors. I think it's worth that small risk, because the risk being 2 out of 100 to get leukemia or 1 out of 10,000 to get a problem from the vaccine. So if they're outdoors, their risk is greater to get the actual virus. So I do vaccinate. The vaccine is not 100%, but I'll tell you, in 20 years I've seen 2 cases of cats that are vaccinated yearly that actually developed the virus and died. So that's leukemia virus in a nutshell, and thank you very much.